Well, we all know that part of a healthy oral care plan includes regular visits to the dentist and dental hygienist. Not only do they keep your smile looking great, but they can also identify the first stages of several much larger health issues. And joining us now to talk a bit about how important those visits to the dentist are is Dr. Brian Kucey. Good morning, Brian. Nice to see you.
Good morning, Mike.
Thanks for coming. I've seen you on TV before.
Yes, occasionally.
Well, let's talk about this particular month. Shay and Aaron made reference to the fact that it's Oral Health Month and Oral Cancer Awareness Month. Very important to be dealing with this.
Yes, this is the springtime when it's not snowing, and we're having like a renovation of our health generally, and we're looking at how are we doing with our teeth, how's our body generally, and oral cancer unfortunately hasn't had an improvement in its survival in the last 40 years.
Is one of the reasons because it's not diagnosed early enough?
Early diagnosis is very important.
And is a diagnosis typically made by a dentist in a situation like this as opposed to a general practitioner?
The general dentists do diagnose these areas and refer patients to specialists, but often some of the patients with oral cancer lesions don't see dentists at all. They end up in the emergency departments, and physicians may diagnose them.
Okay, let's talk about the difference. There are so many different forms of practicing dentistry, so many different specialties, areas of expertise. Prosthodontist, which is what you are, yes, versus a general dentist. Mm-hmm.
Well, prosthodontics is one of the 9 dental specialties in Canada and the United States. And prosthodontics is often thought about as the diagnostician group, sort of like the CIA of okay, CSI, sorry, of dentistry, where we're the diagnostic experts. And we can also divvy up the treatment to other specialists if required.
So explain what you mean by that. Is it a situation where somebody might go to a general dentist and they're kind of confused as to what the issue may be, and then they send them to the CSI agent, as it were?
Yes, most of our patients come from general dentists and other specialists. Very few just walk in on their own, although that's permitted. So when the dentist is having a concern with the patient, or the patient is asking more things to be done than the dentist is comfortable with, they will often refer that patient to us.
Give us an example of some of those things that you would do that not necessarily a dentist would handle then.
Well, sometimes jaw joint problem concerns when a person's been in an accident, a missing front tooth, which can be a high-risk treatment because the person may have a high smile line and you can see everything. Those are some things that dentists are not comfortable all handling. And the other extreme is when we have very prolonged advanced dental disease and people don't know what to do as far as solving their problems. So they will be referred often to the prosthodontist.
I know, this is a before and after shot here. You just want to comment on this?
Well, this is a patient that had some significant problems there with the space between their front teeth, but their complaint was generally about their aesthetics. But when we go further and look at it, this person has widespread dental disease, in this case, periodontal disease.
And there's your after shot there.
Mm-hmm.
So obviously that's quite the difference.
That's a big difference. It's a life changer for a lot of people.
A lot of work to get it to look like that?
A lot of work.
Yeah. Let's just talk about one other thing. I know something else you do, among many things, is dental implants.
Yes.
And I know that a lot of people, when they find out the price and the cost of that type of procedure, decide to go down to other places like Mexico and other countries. It's called, I guess, dental tourism.
Yes.
Difficulties with that? Well,
some people do report some successful outcomes, but my experience is only with the unsuccessful ones when they come back to Edmonton or to this area. And the problem is we have a lot of regulations in Alberta to ensure high degree of safety for patients and dental care. And these other places do not have these regulations. So it's not equal. It's not a commodity that just crosses borders equally. And so there is a high risk in a number of ways, infection control for being one, and just the quality of treatment. So in Alberta, we are obligated to do the highest level possible, and the other areas are not. So it's not a fair playing field, but you can also find problems locally as well.
Sure, sure. All right, well, thank you so much.
Nice to meet you.
Good luck with the month. Hopefully you spread the information and get it out to as many people as we can. April Dental Health Month. For more information on proper dental health care, you can contact the experts. We have the information, the Kucey Dental Group up on the screen for you. There's a website. There's also a Twitter handle, and they'll give you all the information you need.